Okay, shall we start? Okay, good morning and good afternoon, everybody from different parts of the world. We are now starting our seventh seminar in this series of trust and regulation organized by TiGRE, this research project funded by Horizon 2020. And we have today with us Frédérique Six and Monika Glavina. They are going to talk us about the topic on trust and rule compliance. As usual, this is going to be a presentation of about 30-40 minutes and then an open discussion with all the people attending in the seminar. We can use also the chat for questions, and I can also then to transmit to the presenters. Professor Frédérique Six is a visiting professor in the GovTrust Center of Excellence at the University of Antwerp and associate professor at the Vrije University in Amsterdam. And she has very much work on the issue of trust in public governance, in particular about the relations between trust and control. And she is also part of the TiGRE consortium that we study trust in governance and regulation in Europe. And Monika Glavina is a postdoctoral researcher associated with the GovTrust Center of Excellence, research group Politics and Public Governance at the University of Antwerp as well, at the Faculty of Law. And she is also involved in the TiGRE consortium. So thank you very much for accepting the invitation to participate in this series on trust and regulation. And the floor is yours, Monika and Frédérique. Probably you have a presentation, I guess.
Yes, we have a presentation. Thank you, Jacint. I will start sharing the screen. Well, welcome everyone on this afternoon just before the Christmas holidays, or at least that's the Netherlands and the Belgian, the lowlands perspective. I saw someone from Toronto where it's morning logging in. Today we will talk to you about trust and rule compliance. And first I'll give a broad brush bit of context, then go into some ongoing research we're working on digging deeper into what are the theories to explain the relationship between trust and rule compliance. And finally, Monika will present recent research we have done in Antwerp on trust and rule compliance of COVID measures, and where we look at different moments in time and during the first wave or period of the COVID crisis. So first of all, on Monday, I gave a webinar to the Professional Association of Inspectors, Auditors, Supervisors in the Netherlands, the academic network, and it's a great platform where people from practice and academia meet. And that triggered me to think about the past decade, 2 decades roughly, of regulation in the Netherlands and policy making on regulation in the Netherlands and the role of trust. And basically, around the turn of the century, the Braithwaite's pyramid model was very popular. But even though trust is quite central in the responsive regulation theory, trust as such in that pyramid wasn't really that central. Yes, you start on the bottom with trust, and then as you escalate upwards, at some point you move from trust to control and more distrust, but it was clear that people were struggling with how that works and when you do that. So it didn't get that much attention. And then we had, I think it was 3 or 4 governments that didn't survive it to the end. So that's why in about 7 years, it's plural in terms of governments. run by Prime Minister Balkenende, and they had the right analysis to say we need to focus more on trust between citizens and government, and also between government layers. But sadly, they interpreted trust as doing nothing. So when applying it to inspections, they almost literally said, applying the trust principle to inspections, we cut budgets by 20 to 30%. So not surprisingly, people working in inspectorates were struggling with this and didn't believe that was the right way to go. Because trust isn't doing nothing. Trust is just a different attitude and a different way of relating and doing your work as an inspector. But the government basically wanted to grant businesses, as they called it, inspection holidays. But there was also experiments, new developments in developing trust approaches for trustworthy businesses. So that was interesting thinking. And we still have some of these approaches. We can see that in practice. But not surprisingly, when you have budget cuts, and anyway, without budget cuts or not, there will always be incidents. But in 2011, 2013, roughly, and the people on Monday agreed that that was roughly the right moment in time to pinpoint it, that you can see the political wind change away from trust to stricter enforcement. And I noticed it looking back that actually for a number of years, I wasn't asked to talk with inspectorates about trust or asked to give presentations, which was okay because I was busy enough. But over the last year or so, they're calling me again. They want me to think with them, and they want to sort of get back on track, or where are we in thinking about trust? So it seems to be that the political wind is changing back to trust. And of course, that's not unsurprising, and that happens in more policy domains, that topics move on and off the agenda. But what I see now, looking back, and again on Monday, many people agreed that it now has a more solid foundation. The reason why people start coming back to thinking about trust and looking at trust is because they want to base their policy making and implementation programs on insights from behavioral science. And they're aiming to influence behavior of regulatees. Whereas when I started in the field around about 2007, I noticed that most policy documents and also a lot of academic research was saying, the aim of inspections is to change behavior. And that actually assumes that regulatees don't comply. So you start on the basis of distrust rather than on a basis of trust, which has an impact on the way you interact with each other. So why do we look at trust? If there wasn't any regulation, citizens would face the question of how much can I trust an organization like a hospital or a school or a factory where you want to work or not, or you want to maybe buy a house or rent a house next to. And individual citizens don't have the information necessary to base their decision on with enough trust or not. And also it's very inefficient if every single citizen asks that information from the organization. And often citizens don't have the competence to decide whether a process in a production plant is safe or not. So there's lots of reasons for efficiency, but also effectiveness to have a regulator who says, I had a good look at the organization, and I now trust the organization will take your concerned citizen sufficiently into account, so you can trust them. They are trustworthy enough. Now, if the citizen trusts the regulator, they are likely to take on board their advice or their judgment. And in trust literature, we call that the third-party role trust. if one actor, the citizen, doesn't have enough basis for trusting another actor, the organization, but they trust a third actor, the regulator, who says, I trust the organization, I know it, and I trust the organization, that they take on board their judgment. Now, in the Netherlands, especially when I came into the field for the first time around about 2007, I got lots of inspectors who said, that's all nice that you say that. But we were taught when we entered the field to do our work based on healthy distrust. And I then often say, well, what is healthy? Does healthy make it okay? Why not? Why do you add healthy to it? But the essence is, in this dynamic, if the citizen trusts the regulator and the regulator distrusts the organization, then because the citizen trusts the regulator, they will take on board the regulator's judgment and attitude. So they will also start distrusting the organization. And then you lose the positive impact of the regulator. Now, also, you have situations where the regulator trusts the organization too naively, too blindly, because they're captured, so they're too much one on with the organization and do no longer take the citizens' interests and needs sufficiently into account. Then yes, the regulator and organization, there's trust, but the citizens should really distrust the regulator, because the regulator doesn't take their needs and interests into account anymore. And when the citizen distrusts the regulator becomes irrelevant in their question, can I trust that organization? So therefore, looking more closely at this relationship, the regulator-regulatee relationship, and how trust works in that relationship has been studied a fair amount of time, but there's lots of different theories that you can see that have been applied. And sometimes there's not really a comprehensive formal theory formulated. So that's the second part of the presentation. And it's still ongoing research, in the sense that we started with the systematic literature review that Koen Verhoest and I did for an edited volume, Trust in Regulatory Regimes. This book. And in that, we did a systematic literature review, and 10 of the studies in that review are on this relationship. And then in the volume itself, there are 2 more. And then I also add in this overview the presentation, the research that Monika will present, that we did in Antwerp. And the idea is, but we need to, of course, talk about that first in the TiGRE consortium, to extend it by including the relevant sources in the systematic literature review that was done there, because it adds more years. And then because 2020 is almost at the end, we will probably add that as well. So we have 5 families of theories. Responsive regulation theory, which if you then look at John Braithwaite and Mackay's study on trust and compliance, which really was the first systematic testing of that relationship, they based themselves on civic republican theory. Then Valerie Braithwaite developed motivational posturing theory, and even though it started without much attention to trust, in later work she added trustworthiness as a factor into it. Then Tom Tyler developed the group value model in psychology, and not first applied to regulation. Then they applied it to policing and published a book on why people obey the law. But again, that's mainly in policing, and policing and other regulation domains are quite different. But Tina Murphy and colleagues have started applying procedural justice theory, adding trust to it, to the more common regulation fields. Then one theory that I didn't know because I wasn't a tax researcher, but when you do a systematic literature review, you get lots of different domains coming into your sites. And the slippery slope framework is really developed solely within tax regulation, developed by Eric Kiechner and colleagues, and looks at trust in authorities and power of authorities. And that tends to have been applied in international comparative work. So that is an interesting context. Then you have two motivation theories. Self-determination theory, again developed decades ago in other contexts. I did a conceptual piece to bring it into the regulatory field with adding trust to it. And then Mills and Rice in 2017 applied it empirically. And goal framing theory is, again, it's a sociological theory looking at how do people frame their decision making and what goals are frame that decision making. Again, developed in a different context, but Julien Etienne, by Sigi Lindenberg and colleagues, and Julien Etienne applied it to regulation conceptually, both in, for example, publication in regulation and governance, and then the publication, this research, Monika will talk about it, adds trust to it. So you see different origins also of how theories have been developed. I don't have much more time to go into each individual, but when you look at, can we move more towards integration? You see that, first of all, and that was also something that took time to sink in, they actually look at different trust relationships. You have regulator trust in the regulatee, 3 study that, and you have regulatee trust in the regulator. And because trust is really directional, it's relational, but also directional, that makes a difference. And logically, it also leads to differences in models in terms of drivers and mediators. But also it points to the importance of mutual trust and distrust and what happens in the actual interaction. And because these theories tend to have been part of studies that were then tested, the theories were tested quantitatively, but also other theories came up in the systematic literature review that were qualitative and really looked at the interaction. I will come back to that later. Then similarities. All of the theories talk about legitimacy in the broad sense. And that could be legitimacy of authority or legitimacy of the rule or the law. And sometimes more explicitly and sometimes more implicitly. For example, the civic republican theory and responsive regulation theory more broadly. But in that study by John Braithwaite and Tony Mackay, it is a footnote because it is assumption that they make. So it is always in there. Procedural justice, of course, in procedural justice theory, it's explicitly in there. In others, it can be less explicit. In motivational posturing theory, it is in there in terms of the integrity of the regulator, whether they treat them, the regulatee fairly and with respect. And then thirdly, many theories look at acknowledge that there are different motivations possible, and people can have at the same time have different motivations and they can compete, and they take that into account in terms of the impact of trust on compliance. For example, motivational posturing theory says that the very dismissive, disengagement motivations, trust isn't relevant because they're totally not interested in the relation. So whether the regulator trusts them or not is irrelevant. Some variables that are unique to one theory could be interesting to broaden our horizon. For example, social contagion is very central in goal framing theory, and we don't really see it in other theories. And that seems to make sense because social contagion is about the observed compliance or non-compliance of other regulatees. And social goal framing theory moved into regulation and compliance theory through norm compliance, littering the street, graffiti on the street. And so it's a lot of other regulatory fields, you don't observe the compliance of other regulatees so easily. But what it could trigger, or at least what it triggered in us when we looked at it, how about the gossip, the informal social networks that you know that other people are complying or other people are not complying, and you don't want to be the fool who complies while no one else does, or you are concerned about a level playing field. So that could be relevant and interesting. Power, the power of authorities. It probably relates to the legitimacy, but it could be interesting to study that more carefully, and also the work, that the way that framework has been applied in international comparative work might make it also interesting. And then finally, self-determination theory focuses our attention to the regulators' generalized trust in regulatees. And very little research has been done on that, but you see some studies that ask regulators, do you believe that most regulatees violate the rules, which really goes to this generalized trust or distrust. And it has an important impact in how, as an inspector, you approach the interaction with the regulatee. So that leads us to some of these qualitative studies. And I always love reading John Braithwaite when he talks about how subtly the individual inspectors interact with the regulatees to get them to comply or talk about and be open up about how well they are complying or not, what they're concerned about. And there you see the importance of the interaction and therefore the mutual trust and distrust. And Heimer and Gaisley, looking at HIV clinics, also talk about these encounters, and they use a theatrical metaphor to show that by the way they interact, the inspectors interact, they can get the inspectees, the regulatees, to open up more and be more open, and therefore be more make themselves more vulnerable about the concerns the regulatees have. And they'll only do that when they trust the inspector, and the inspector will only really engage in such a sort of co-production and even helping them to perform better together when there's a basic trust in that the regulatee is willing to comply. So they may not be competent in all respects, but overall they're willing to do their best and comply. Now, Massini and Van Wijk in regulation and governance did interesting work, which so they asked the regulators, the inspectors, this question that I just mentioned, which you could relate to generalized trust in the group they inspect, but they also asked the small entrepreneurs after the inspection, how did you experience it? And a lot of them said, well, basically responded in ways that shows generalized distrust in authorities more generally. So also, particularly this inspector, they're an entrepreneur, and there this inspector comes around to tell them what to do. So a distrust of authorities more generally. And then finally, Cunningham and Sinclair, who looked more largely at mining safety, not at the actual interaction, but more over time, that after a couple of serious incidents in mining in Australia, the government forced the inspectors to be more repressive, whereas before that they were cooperative. And over time, all parties agreed that overall this led to lower safety in the mines. So the aim of not necessarily the compliance, but the aim of the regulation is to improve safety in the mines. So It leads to the importance of behavioral science, of perceptions, motivations, influencing behavior, and also the importance of the interpersonal communication skills of inspectors, especially the work of John Braithwaite and Heimer and Gasly showed that. So tentative conclusions. That mutual trust does have an impact, but be careful when you look at theories or quote theories, which relationship do they focus on? We should pay more attention to generalized trust or distrust, both from the regulatee in authority as well as the inspector in the regulatees as a group. Trust involves showing care and concern for the interests and the concerns of other actors, and realize, be aware that the concern of the regulator is to obtain the relevant information, whereas the key concern of the regulatee is, will I be treated fairly, with respect, and relative to other people? Are the procedures just? So as you build a relationship on either side, it's important to be aware of those differences in concerns. And of course, as I already mentioned, the importance of the interpersonal communication competencies. And these, especially 3 other factors that are really worthwhile taking on board, and depending on the context, are they applicable or not? This ends my part, so I now hand over to Monika, but I will continue to work the sheets.
Great, thank you very much, Frédérique. So, in this second part of our presentation, we focus on theoretical explanations.
I'm trying to mute, but I can't do that using my spacebar. Go on.
So in the second part of presentation, we focus on theoretical explanations on the role of trust on rule compliance. Although many of these authors that Frédérique mentioned use empirical evidence, of course, to support their theoretical claims. But here in the third part, the last 10 minutes, we come to the question of what is the role of trust on rule compliance during the current COVID-19 crisis. And to answer this question, we relied on a weekly survey conducted by the University of Antwerp on the impact of Corona crisis. And although the survey was predominantly medically oriented, on 3 survey dates, we had an opportunity to include trust and compliance questions into the survey. And this gave us a chance to focus on the dynamics of trust. So next slide. So thanks to this, we derived the following research question. Frédérique? Yes, so we asked, how does the effect of trust and other factors on rule compliance change over time during the COVID-19 crisis? And how can we explain these dynamics? So as was already emphasized by Frédérique in the first and second part of our presentation, trust has a positive effect on rule compliance. So this effect holds both in normal times, if you look at, for example, food safety, road safety, mining safety, but also in times of crisis. So that citizens' trust in government has a positive effect on rule compliance, has been suggested and also proved by research on the financial crisis, SARS crisis in Asia, Ebola crisis in Africa, and even by some of the very recent studies on the current COVID-19 crisis. So building on this literature on trust and compliance, we derived our main hypothesis of our paper, and that was that citizens' trust in government will have a positive effect on rule compliance, and this will hold during all phases of the crisis. And we test this hypothesis. Yeah, next slide. We test this hypothesis in the context of Belgium, and more specifically Flemish region in Belgium. As you can see on this figure, this figure shows the number of new COVID cases in Belgium in blue, together with the number of hospitalizations in green and number of deaths in red. And vertical dotted lines represent governmental measures. You can see here when the lockdown was introduced. and the full lines represent the dates of our survey. And you can see that this first survey was launched when at the peak of the COVID-19 infections. Survey wave 2 took place when it was clear that this lockdown is working and the number of infections, hospitalization, and deaths started to incline. And then last survey wave was launched after a series of government relaxation measures and when the number of infections has been low already for a while. We also use bootstrapping to correct for the discrepancies in the number of participants across the survey waves. And we weighted the data by age, gender, education, and province to achieve a more representative sample. So what do we find? So this is a complicated table, but don't bother to read everything. The purpose of showing this table is to illustrate how we analyze the data. So you can see here only wave 1 at the peak of the infections and 6 steps that we took. So we started with a battery of control variables. So these were age, sex, living situation, and education. And we added our main explanatory variables. So the main one being trust in government, as I already said, but also other variables such as rule legitimacy, which we operationalize with 2 questions. So the effectiveness and the appropriateness of rules. Then fear, which we operationalize with risk proximity and risk severity. One's pro-socialness. And finally, social contagion. So that means observing other people's compliance. And you can see that social contagion is quite important because it adds about 10% of the explanatory power to our model. And what I want to stress here before moving to the next slide is that trust in government starts significant, but then the significance disappears as we add other variables. And I will come back to the explanation for this later. So in this table, we focus only on the last step. So step 5 with all of the variables, but in all survey waves, all 3 survey waves that we are focusing on, but we only show those variables that are significant. So from control variables, only age and gender are significant across all 3 survey waves. But as for other main explanatory variables, so you can see that there is a clear visible difference across the waves. So there is clearly some dynamic going on as the context of pandemics in the Belgium was changing. So I'm going to first focus on wave 1. So this first survey wave was dominated by uncertainty and fear. So rule compliance here is predicted by social contagion, the perceived severity of COVID-19 and the appropriateness of government measure. Trust is not significant. So instead, what drives rule compliance in this first wave is social contagion. So observing that other people are complying. And this is clear because you can see that streets are empty. So people comply. And the other one is fear, because fear of the virus is high. Social distancing rules make sense regardless of who is imposing them. And this makes trust in government irrelevant. As for the second survey wave, this was the time when it was clear that the epidemiological measures are working. So the curve has flattened and the spread of the virus became slower. But people still perceive the severity of COVID infection high. So they are more likely to comply. But the risk of getting the virus, risk proximity, goes down. So as a result, people who still consider the risk of getting infected high continue to comply, while the opposite holds for people who consider the risk of getting infected as low. And this is why the proximity becomes significant in the second wave. The rule effectiveness also goes down significantly as people see rule as less effective. For example, carrying a mask on a street when it was summer and the infections were low for a while. So this makes the variable significant in our regression model. Why? Because those who still see rules as effective are more likely to comply compared to those who see rules as less effective. And finally, in our third survey wave, the curve of infection was flat. There was substantial relaxation of the measures. And here it's very interesting, the one's pro-socialness, the willingness to take interest of others into account is significant for the first time. So how do we explain this? So we argue that as fear keeps going down, complying with measures required more personal effort. So pro-socialness becomes an important factor inducing compliance. And surprisingly here in the third wave, as you could see, the trust is significant, but with a negative effect. So one possible explanation for this is that the measure that we use for rule compliance and measure we use for trust are no longer aligned. So compliance in our study focuses mainly on the epidemiological measures. So it is measured with a question, to what extent did you change your behavior in public spaces and shops according to new guidelines? While trust is measured with a question, to what extent do you trust the federal government to deal with the COVID crisis in a good way? So this trust measure is much broader than the compliance measure, because it does not take into account only epidemiological, but also economic and social measures as well. So what we argue is that as the time passed, the focus has shifted from epidemiological to economic and social consequences of the crisis. And finally, I will conclude. Next slide. So what was the added value of our paper? What are the main takeaways that we would like to give you? So we try to combine different strands of literature on trust and compliance from what was Frédérique was talking before. But the added value of the paper is that we examine the dynamics of the drivers behind rule compliance. So as you could see in both of my tables, there was clearly some dynamic going on. There was an interaction of drivers and rule compliance was varying depending on the different phases of the crisis. So depending on what the context was, what was the number of infections, the number of deaths, etc. And this is why it's very important to look at the dynamics as we have done here. What we can also conclude is the role of the trusting government is very nuanced than initially thought. And actually fear and social contagion are very important drivers of compliance and should be included in the future study. And finally, we propose that goal framing theory that Frédérique covered in her part of this presentation is a very strong candidate to explain these dynamics of drivers of trust. And finally, I would like to use this opportunity to promote our GovTrust annual symposium that will be held on 29th of January. So it's a Friday. And there we will discuss some of the most recent research on trust and COVID-19 crisis from political social science perspective, but also from legal perspective. So you can register on our website. And thank you very much. I'm really looking forward to comments.
Well, thank you very much, Frédérique and Monika. Let's now open for questions. There are a few questions on the chat. Maybe we can start addressing these. Some of the questions are more precise questions that you can clarify. And in the meanwhile, maybe we can prepare so the participants will be interested to raise other questions. First question is about a triangle that Frédérique was presenting at the beginning. And the question from Nancy Reichman is very simple. The regulator has no obligation to trust citizens. Why is that?
Yes. Well, in the dynamic of the triangle itself, it isn't directly the most relevant whether the regulator trusts the citizen, because the regulator is serving the citizen. Now, of course, ultimately there is the mutual trust still going on. And there's in the Netherlands there's a big crisis on where the tax office has made to put it bluntly and not politically correct seems to have gone off the rails in terms of being biased towards citizens, but citizens as regulatees. But if you're, but generally speaking, if as a regulator you don't trust citizens, you tend not to be too concerned about what concerns them, about their needs to have a meaningful relationship with the other actor. So yeah, it's difficult to have an obligation to trust. I don't think that would work as a concept, an obligation to trust. But if a regulator doesn't trust citizens, they will be less likely to be willing to take the citizens' needs into account, and therefore they will not be able to play that crucial but difficult role of a regulator to basically deal with that almost inherent moral dilemma of taking into account these often competing interests of the citizens and the regulated actors. Because if there wasn't a competing interest, you'd almost not need any regulation. So it's just from the trust, the third party role trust concept, that is not the key relationship. But in the background, yes, you're absolutely right. If the regulator actively distrusts citizens, it's unlikely to be able to perform its role properly.
Thank you. There is another question for Monika in this case. It's about the table that you presented, Trust in Government. And the question says, it's from Monika Glavina, says, Trust in Government handled the economic crisis. How did you conceptualize this in your questions, the handle the economic crisis? Do you mean trust in governance to handle the economic crisis, or trust in government that handles the economic crisis?
Yes, thank you for this. And I also see that it's a very similar question to what I have from Timothy under. Maybe I can share screen. Would that be possible to show questions?
Shall I do it again, or do you?
I think I can do it. Let me see.
Okay.
Can you see it?
Yes.
You can see the PDF, right? So you can see that compliance was measured. To what extent did you change your behavior in public spaces and shops according to the new guidelines? So it doesn't, sorry?
Can you perhaps make it a little bigger on your screen?
Yes. Better?
Yeah.
So we did not ask specific, so it pertains more, it has nothing to do with social and economic measures, but it has with epidemiological. So changing behavior would be keeping social distance and wearing a mask. While government, and that's here, is measured with a question, how much do you trust the federal government to tackle the COVID-19 crisis in a good way? So to tackle it epidemiologically, but also tackle the economic and social consequences of the crisis, which became more important in the summer, right? Or after the summer now. So that's it. You can see that this could explain why there was a negative effect of trust, because after the second wave, when survey wave, when social economic consequences became more important, compliance was still measured with a more epidemiological one.
And there is a potential second explanation for the negative effect. You know, if that measurement issue isn't a real concern, and you see it in more and more countries, trusting government doesn't just go down because people think the government is doing too much. There's large proportions of the population, both in Belgium and I know in the Netherlands, but also in other countries, actually think the government at certain moments wasn't doing enough. So if wasn't strict enough, or was relaxing too quickly. So they would continue to comply even though their trust would go down. So that creates a negative, but there's, on the basis of this data, we can't judge, say either way. But it's an interesting conception. Monika, about the multicollinearity of the collinearity?
Yes, thank you. I think we did run some tests to take this into account.
Yeah.
And I don't think multicollinearity should play an issue, especially also because we use weighting and bootstrapping.
We had a good look at collinearity, and that wasn't a big problem.
Yes.
And in terms of who reserved the survey, the problem, well, the weakness of the survey is that it's not a representative sample, but it was a web-based, and people who heard of it via the internet or via email or whatever.
Mm-hmm.
But again, the weighing and the bootstrapping did help a lot to correct for that. But of course, yes, you can't have it.
Yeah.
Is there difference in the drivers for individuals?
May I just add something for the who participated in the survey? I think it's really important to emphasize the number of responses that we had. So for the first survey wave it was 200,000, for the second one 100,000. So there was really heavy interest for participating in the survey. So for the numbers that we collected were really impressive.
Okay, so well, there is a question about, maybe you already responded, but it's about the who received the survey, no, and what kind of all drivers.
Yeah, we did
maybe
that one.
You can say something more about how you manage this.
So the survey was sent out through worker panel, I think, and also social media, and of course the sample was not representative, but of course we weighted it. But we had people from Flanders. That's why survey was launched throughout Belgium, so including Flanders, Wallonia, and Brussels. But because of there was a disproportionate number of responses throughout the regions, we only decided to focus on Flanders in our data, in our paper. So that's why we exclude Brussels and Wallonia. But yeah, it was predominantly, it was respondents were people that were younger than 65, more highly educated. That's why weighting made sense.
Okay, but there is another question about, well, it's a question about whether there was a question on how they perceive compliance by others.
Yes, there was. That's the social contagion question.
Yes, and the exact wording of the question is, to what extent did people in your surroundings change their behavior in public spaces and shops according to the new guidelines? So observing compliance of people around.
Great. So there is another question by Charles Rapp, and I read it. Do you have granularity on what qualities people want government to have in order to be trusted for COVID-19 action? Effectiveness, efficiency, consistency, benevolence, fairness, privacy protective, or what?
No, sadly not is the easy answer. We were just, these surveys that are sent out regularly, and we were lucky to be able to add 10 questions to it. We didn't do that research, but I know that the Antwerp Research Center is called GovTrust, but there is a TrustGov Center in the UK that has done some interesting work also on trust and COVID. And for example, they did a couple of focus groups to be able to go a bit more deeper in how people perceive the different policies. And one thing I know, they wrote some blogs and research notes. One thing that really stood out was how the government dealt with Dominic Cummings breaking the rules. So the procedural justice, that really is about procedural justice. And you can see around the world that, I mean, that in their focus groups, that had a huge impact.
Yeah. It seems to me that that's a very important thing that we would want to find out about, because if people, they want to trust government or not trust government for doing or for not doing various things. And I think that maybe next time in the next survey, if you could find a way of getting granular on that, that would be wonderful.
Yeah, yeah, it's well, what you see regarding the leading by example. So the Dominic
Yes.
Cummings example.
Yeah.
In Scotland, I think it was the medical chief or the vice chief medical officer or one senior person who drove to the holiday home against the rules. She stepped down. In New Zealand, at least the minister stepped down. In the Netherlands, we had the problem that the Ministry of Justice, the Secretary of Justice, who had, before he became a secretary, was widowed. So everyone was happy he was getting remarried. But during his wedding in the summer, not all the rules were followed. So, and he's still suffering from that, leaking to the press with pictures in the media.
Yes, exactly.
So you really see that, you know, people are walking on eggshells.
Well, there's a lot of anecdote about, I mean, in the UK, there is a general anecdote that, well, the Dominic Cummings thing really damaged people's trust in government. Now, I don't know whether there's any research that bears that out, or whether that is simply a kind of media response about what a rational person would do if they saw Dominic Cummings breaking the law. They would reduce the trust in government. So I don't know whether there's research on that in the UK, but that would be interesting to find out.
That Trust Gov focus group research.
Yeah, but is that only a one? I mean, has that been replicated in any way?
They did several focus groups before and after that incident.
Okay.
And they really saw that as jumping out and having an impact on the people in the focus group.
Right. I wonder if that erodes over time.
Theoretically, you can argue that it goes to the legitimacy of the authority. And in goal framing theory, they really point to the fact that breaking the rules is so much more impactful than seen to be following the rules.
Yeah.
So there's an asymmetry, which also makes a lot of sense.
Okay.
Thank you.
There is another question by Nancy Richmond. It's about, says, over time, people have more experience with COVID, for example, knowing others who have been infected, for example. How might knowing somebody who has infected matter? Seems different, that perception? So it's
we measured that with the risk proximity. So in a way, when at the first wave, when the infection rate was high, everyone felt high risk proximity. But as the infections came down, risk proximity changed. Lots of people, especially those not working in care or having vulnerable elderly people, like the young among us, reduce their sense of risk proximity, whereas the people still working in healthcare, seeing the horrible cases every day, remained very aware of the risk proximity.
Very interesting. More questions or comments?
Can I follow up just on that? It just seems different to be measuring people's perception of their risk versus people's experience. Like a measurement is, do you have, what percentage of people have knowledge of or experience with COVID. Maybe they've had it. Maybe their family members have had it. That seems a different kind of, it's an exposure versus a risk. And I guess I don't know if exposure is a control factor in this or if it should be a driver.
Monika, you have the PDF at hand.
Yes, sorry, can you repeat it? I was following the other question.
Yeah,
I think there's a difference between exposure, like people have actually either had it or their family members have had COVID infections, and a perception of risk or
Yes.
perception of exposure. And I wasn't quite sure. I thought you measured perception, not actual exposure.
Yeah, so it was to what extent do you think that the risk, yes, to what extent do you think that the risk is high that you, your family or friends will catch the corona crisis? So
right, but that's different than having caught it or knowing someone who has it. Or
exactly. So it's
I know that in the survey, in the medical questions, there were questions around what you're pointing towards, but given all the privacy arrangements, we weren't immediately, as we were writing this paper, given access to those questions. But now that we are collaborating more with the medical people from the University of Antwerp, for example, in August, we did a wave where we asked questions about vaccine hesitancy. There were some questions that were really medical that we could look at, but that's the ethical boards of the university world.
Yes.
But it's interesting. We could see if we could get access to that question and see what impact it has to make that element stronger.
Okay, there is a question, very short question about whether this is about trust in government in Flanders or federal government.
We measure trust in federal government, trust in regional government, trust in local government, and trust in EU. And it didn't make a difference in the analysis. So because especially at the beginning of in April, it really was federal government setting the measures.
So
that was the key one. Hi, Leo.
Hi, good to see you.
Sorry.
Yeah, my question, I'm a public administration scholar, so I didn't see it in the overview. There was in the research question, there was the federal government was mentioned, I guess. But it's good to know that there is in the research concerning rule compliance, it didn't matter. So there were comparable figures about the confidence in the different types of government that are related to the COVID crisis. Because, of course, the countries rather differ in which parts of government, which government levels, which regional levels take the forefront in it. And so that might be important. Thank you.
That's going to be another paper that we're looking at the trust in different. And what did struck us that in the first survey waves, so April, trust in EU was relatively low to the other trust measures, but at that time the EU wasn't really important because formally the EU has no role to play in public health, and only over time, especially with the economic measures, it got a role for itself, so to speak.
Okay, thank you. There was another question, but it's Ben said, maybe he wants to set the question to, I don't know, Ben, sure. You want to please go on.
Thank you. So two things, just a little response to Charles, because I've had a look at some of the data in the UK. And where they've done surveys that have measured over time people's views, there's a definite spike around the Dominic Cummings affair. So trust really declines, particularly around that very narrow period. So it backs up what Frédérique was saying about the focus group. There does seem to be something very specific there. that damaged people's trust in government. My question for Monika and Frédérique more broadly was, in a sense, to reflect on the two parts of the presentations, because Frédérique's first part was essentially trust matters for compliance, and that's what we're told all the time. Virtually all the papers start with this idea that trust is very important. And yet, of course, if that were the case, and you were looking before the crisis at countries in Europe and predicting how their citizens would respond, you would have said Italy is in a real problem because trust in government is so low there. Surely the Italian citizens are not going to do what their government have said, and to my knowledge, that's not the case. So the variations at the aggregate level between countries and levels of trust do not seem to have played out in terms of varying levels of compliance with citizens, which makes me think actually that when it comes to something like this, you're absolutely right, that trust is much less important than either fear or just a general social compliance. And so in a sense, I was quite heartened to hear your findings that trust doesn't matter. But in a sense, my question was, why do you think in that case, we have all these studies which show that trust does matter, and there's a presumption that people's trust in government is important for compliance, when actually your results suggest maybe it's not quite as simple as that.
Yeah, thank you. It's yeah, of course, we were surprised by the results, but when you think about it, most of the research done on that relationship between trust and compliance doesn't include fear and doesn't include social contagion. That's one. The second part could be that when you study in the triangle, the citizens who are vulnerable to the behavior of the regulated organization, they're two different actors, whereas here we're both regulated actors and the ones who are vulnerable to non-compliance. So it is a special situation. That might be an explanation. But also it is, I mean, when you look at crisis research, it is, you know, there's a rally round the flag effect. When there's an external crisis that cannot be pinpointed to bad government behavior or policy making, it tends to be that support in government rises and people are willing to comply with what government measures are. And that the rally round the flag effect, and that comes from when a country is usually, you know, it started with sort of military threats, hence the metaphor. But it has also been shown in other situations. And Tom van der Meer, political scientist at the other university in Amsterdam, has done interesting research to show that this rally round the flag effect is occurred in many countries around the globe in the spring, but not in Brazil, where from the start Bolsonaro ignored it and said it doesn't exist. And Trump went up a bit when he was harsh on China and then came down as well. So then, and that's what Ben referred to with the Dominic Cummings effect. That was something you could say the government was at that point not performing properly. So when you can't blame the government, trust is high, but once the government starts to have to make difficult decisions and you know, is involved with lots of moral dilemmas in policy making, because whatever they decide, people get hurt at the moment, whether you go in a lockdown or not, as most European countries are now. That hurts. Yeah, and even though a lot of people say there's no balancing between economy and epidemiology and health, they both go up or down together. But these are very tough things. And when government shows that they don't make the right decisions, then that flag rally around the flag effect becomes different.
Okay, thank you. I think that we have to conclude soon. There is a final question comment by Sean Rapp. I don't know if you want me to read or you want to just to.
Yes, can I do it? The question that I put in the chat is that in the UK, government has kept saying all along that they follow the science. And I wonder whether there's any research that you've been doing on public trust in science and in scientists. And there's a debate now in the UK about the relationship between science and policy in the pandemic, and whether there are mixed signals coming, and whether the scientists have simply been used or misused rather than being followed. I wonder whether there's anything comparable in your research on.
Well, we also managed to add a question on trust in experts.
Oh,
but
good.
Again, that's not in this paper,
Yeah.
but in another, we had 10 questions. We had to be.
I mean,
Okay.
2 weeks ago, 2 weeks ago, we presented TiGRE seminar on intention to vaccinate.
Mm-hmm.
And their trust in expert plays a really heavy role. So how much you trust expert who advise the government to control the corona crisis.
Good.
And so the trust in expert as trust in the government brings to higher intention to vaccinate once the COVID vaccine becomes available.
Okay.
Thank you.
Thank you. Thank you very much. We are going to finish here this seminar on trust and rule compliance. I think has been very well, quite an hour, but very intensive, and we all learn a lot about this research, and we look forward for further papers and researches on your framework. Thank you. Thank you very much.
Thank you.
Thank you.
Bye-bye.